Meantime, humanitarian agency UNICEF has sent critical medical supplies to India as the country battles through that horrific surge in cases. 3,000 oxygen concentrators, diagnostic tests, medical kits and other equipment have been donated to help contain the outbreak. The agency is calling for millions more in donations to help deliver the necessary testing equipment and medical supplies. Joining me now is Dr Yasmin Haque, the UNICEF's India representative. Doctor, thanks so much for your time. I appreciate it. Is this on top of what the government has promised?
Absolutely. This is our part in really garnering the support that we need from across the world in meeting this critical need of oxygen equipment, of testing kits, and also really focusing on how we can be supporting children who are very badly affected by this pandemic.
It's difficult because you're asking for donations, but when it comes to medical equipment, it's hospitals, both public and private, that only have the capacity to do that, don't they?
Absolutely. So we work very closely with the government. We have a team of about 600 across India. We have offices in 13 locations, and we work very closely with the national government and with the state government. And the requests are coming from our counterparts and our colleagues for the equipment for the hospitals that are really having to ramp up beyond their capacity. So this equipment, as it comes in, is not just an immediate an oxygen concentrator and an oxygen plant helps build the capacity of a facility anyway. So we're really trying to address some of the gaps which have been there longer term, but now with the pandemic and the way it's continuing, the need has skyrocketed.
Oxygen shortage is a big problem. We've seen that from our reports from Alex Crawford out of India. What about ventilators? Because we did buy a lot of ventilators here in Australia at the start of the pandemic. Over fears we would need to use them. We had thousands of them acquired. We would have the capacity to send those to India, wouldn't we?
So exactly, I think India is accepting various government donations of ventilators, of oxygen concentrators and oxygen plants. And yes, there is a need for it. So every donation that comes in terms of equipment, and also I think from UNICEF perspective, we've seen such a wonderful reaction and contribution from the people in Australia, how they have been supporting our UNICEF team in Australia in keeping the focus on children too, so that we don't lose count of the children who have lost parents, the children who have their parents have lost livelihoods, especially the poorer children, where children are struggling to continue with remote learning. And of course, the psychological effect of this pandemic on children, the mental health dimension is something we cannot underestimate.